Okay, we are live.
Just waiting for it to come through to United Medical. All right, I'm pressing that now, Kemal.
All right, good afternoon. It is January 15th, Friday it's good afternoon, right? So it's at noon. So we are here from United Medical ACO, our weekly Friday weekly event. We are going to discuss different topics again and give you some updates, but we do have a special guest today. And we are going to so we are going to discuss some of the updates from Humana and their digital health platform. So I'm going to actually start first. I would like to ask you guys to introduce yourself. You guys already familiar with Tanner, but Tanner, we can start with you.
Sure, my name is Tanner Fuchs. I'm a member of the business development team with United Medical. So I work closely with our providers and physicians throughout the state with their EMR and with training and workflows.
Thank you. And then we have Karina Abrams.
Hi there, everybody. My name is Corinne Abrams. I work for a company called Civity Health, which administers SilverSneakers. So I work closely with Humana and plans that offer SilverSneakers, and I'm excited to talk with everybody today.
All right. Well, thank you so much for joining us. So again, our agenda items are pretty typical for this the Friday event. COVID-19 numbers we go through. Digital health, Corinne, that's something that we actually, starting from the beginning of the pandemic, we focus on the telemedicine a lot. And once we find out what you have from SilverSneakers, it actually made it a lot reassuring for us that we are on the right direction. So, and we would like to also see for our patients exactly what SilverSneaker offers. And we do that from the partnership from Humana, from our accountable care value-based contract. And we are going to discuss, we're going to start the vaccine distribution discussion. That's going to be Tanner and I after Corinne finishes her side. So we start with the numbers, the national numbers. Right now we are at almost 400,000 total number of lives that's we lost. With 23,879,000 people who are confirmed with confirmed cases. Now, I do share these numbers directly for Delaware, actually. Before we go to the Delaware number, I do actually share the real data, like whatever is available as of now. We know that hospitalization, total number of hospitalization is high. We share these numbers with our providers on a regular basis, and now these numbers we are pretty familiar with. So we are at 466, and the new hospitalization COVID-related, it's averaging like 56 in the last 2 days. These are the total running 10-day averages. The percent of persons testing positive in state of Delaware, we are at almost 24%, which is, again, kind of on the high side. It's lower than the last couple of weeks, but it's still very high. And then percent of tests that are positive, the difference is the person versus the test, and we are at 9.2% of the tests being positive. And then total number of actual positives are, we are around like 741 running average. So that's where we are from Delaware. And before I actually finish the Delaware numbers, I do want to bring up the Rollout for the United States updates, because a couple of the things was kind of concerning for us was the number of total people who lost their lives. That number was the highest for the single day we have the single day record. And I do want to share that. Unfortunately, it's never fun to discuss these numbers, but just for us to know, be aware of where these numbers are, it's important. So 2 days ago, that number was about 4,100. The day before that we were at 4,500, which was the highest day. Now, yesterday, there's 4,142 reported, and today so far we are at 804. So these numbers are important, and we do want to pay close attention to these. Yes, we have the vaccine, but vaccine is not the solution by itself. We still have to follow the guidelines for the pandemic, and that's the only way that we can go through this trouble, hopefully. So that's what we have from our side. Now, Tanner, you have a couple updates for us with the COVID-19 again?
Sure. So this was actually something we had shared with our patients last week. It's just looking at the CDC is updating and constantly revising their forecasts for all the different metrics that they're using to track the spread of the virus and the ultimate deaths related to the virus. So last week we had shared that for this month, I believe the CDC and Dr. Fauci were forecasting about 60,000 deaths for the month of January. Unfortunately, that has been revised up. And we're getting this from an increase just in the data coming into the CDC, as well as from after this past holiday season. We're still seeing kind of the fallout from that. But we wanted to go back and take a look at where we were heading as a nation here for the rest of the winter. So this is something to definitely be mindful of. As all of these, you can see last time, and I should have circled them again, but last time our numbers were roughly around that 20,000 mark for the week, that these top two are by week. And then the bottom just being total deaths. So both have been, again, for the weekly numbers, we're up about 5,000 in the forecast. And then this is something that we share pretty regularly. Everyone should be pretty familiar with our process here to be able to accurately track, maintain our data within our own patient population. So we're consistently monitoring and tracking the amount of tests orders that we're putting out, which we're actually seeing a little bit of a decline there that's reflected in this bottom graph. My only thought would be maybe you can see I put it out for about a month here. Maybe right before the holidays, we had a lot of people requesting for tests as they were wanting to see close friends and family. But that should not necessarily mean now that we want to be testing any less. We want to make sure we're keeping that rough target we had there for about 300 is where we'd like to be. But of course, always the more tests, the better. It helps accurately reflect the data and makes us more confident in the data we're seeing with the spread amongst our patient population. So going back up here to the top, we're looking at our percent. Oops, sorry, Kemal. Just wanted to quickly mention we did see a little bit of a drop. So that past week for the 4th, most of our tests resulted at this point. We did see, you see that 43% there that is a little concerning now, but I just wanted to mention that we're still following up on a lot of those tests. So once we kind of get more results back, we'll have a better idea where we're at. Mm-hmm. So this is something that we're also keeping track of, and we're part of the process in getting that number is myself and the rest of the business development team. We're actively helping with the follow-up for our practices and our physicians. So if we're seeing that a test result might be a little delayed, or it's been a few weeks since the patient was ordered, but we don't see a result for it, we're actually doing the reach out to these patients just to see if there is any barriers to them getting tested, anything we can do to help. Or maybe they got a test done somewhere where the result didn't flow back to us. So we're keeping track of the amount of patients who are still positive, which we see with this red bar, as well as patients that either aren't getting tested or that we can't get a hold of them for the follow-up, which is a little concerning, of course, because we want to make sure we're accurately keeping track of all the tests that we're putting out and that we're not missing any.
Tanner, I think the good part of this is that people who are given the order of the test, they're completing them. Well, the not really positive side of it is there are more positive cases.
More positives, right.
Yeah. So, well, thank you for this. Mm-hmm. Now we are going to discuss the digital health, and I believe we were one of the early adopters of digital health, and we have Karin. So this is kind of like where you coming and joining us it makes it a lot more important for us to understand where we are. So what we have done starting early April, actually end of March, we made all the online events available for our patients, for our providers, for our employees. So the whole disruption that we have from the pandemic, it was extremely important for us to be visible for everyone, all different groups of people we deal with, again, employees, patients, and providers. So then, every time we have these types of crises, I try to see what, if we have any benefits that we learn or we actually adopted. And I think digital health and importance of our access to what's given to us, I think it makes it a lot more important now. So we are going to keep this with the telemedicine, with the different videos that we are doing, with the different online events we are providing. We'll keep this going even after the pandemic, and hopefully the pandemic will be over at some time. But what we learned from the pandemic, we will continue providing it for our population. Now, when Humana is how we actually got to know you from our Humana value-based contract. Mm-hmm. I know you don't work for Humana, your company is different. So seeing what you had from your platform, we wanted to make sure, although we are providing these different sessions, but if there are more available, and if it's done in a way that's what I have seen in SilverSneakers, it's much better products that I see with the videos. I think you guys have more money than we do. Mm-hmm. So, and I want to make sure that this is available for our patients. And what I'm going to do right now, I'll give you the control from here. I know you have some slides that you want to go through. And if there's any issues with the mouse, you can let me know. But so this is... all right, mouse to. All right, so I think, and I'm not going to touch my yes. My keyboard or the mouse. So can you try if?
Absolutely. Says I can control. So yep, we're good to go. Sorry, guys. We're going to get back to the beginning here. Thank you so much for having me today. As I mentioned, whoops, I'm sorry, I'm going too far now. I wanted to, as he said, take a few minutes to walk through what SilverSneakers has been able to do in the last 9 or 10 months as a result of COVID-19 and how it's affected all of our lives. As you probably know, SilverSneakers started out, we started out a long time ago now in 1992 as a benefit that was strictly a gym benefit that was offered through health plans through a Medicare Advantage program. And we've since evolved into additional ways that we can engage with you. And over recent years, we have had some digital offerings available. We've had an app called SilverSneakers Go. We've also had an online video library that we've had over 150 videos that members could access anytime through our member portal on our website. So even prior to COVID, we were reaching out and engaging with members that had the SilverSneakers benefit in that way. So when all of the shelter-in-place orders happened at the beginning of this year, at the end of March, or last year, I should say, we pivoted really, really quickly to make sure that we were able to still engage with all of you, anybody that had that benefit, because we knew how important it was to stay active and to stay connected with others. So as you can see from the screen, we do engage with people in a couple different ways. So there's the gym benefit that certain areas within the country are still able to utilize. And there's still some members that in those areas that feel comfortable enough to go out and safely exercise at the gym. We have about 16,000 locations across the country that members can utilize. So that's still something that's happening, but as you can imagine, that has changed a lot this past year. We're also out within the community. We have a lot of classes that are available across the country in places like community centers, providers' offices, different places, even parks, whenever we have interest. So led by a SilverSneakers Flex instructor. And finally, we've had in the home, and that has increased exponentially in the last year. So what I'm going to show you is really around a couple of these new developments that we had, that we started at the beginning of all of this. So one thing I'll mention is that we have a SilverSneakers website, and some of these options that I'm going to talk about are available through that website. And I'm going to show you very briefly at the end of my conversation what that looks like. So we have, as I mentioned, our on-demand video library that you can access anytime. As long as you're a member, you can get into learning about any type of things from dance and cardio workout to yoga to stability exercises and exercises for balance. Which I think fall prevention is something that I'm sure that all of you have talked about before. So there's a number of things that we can do to support that as well. We also have our live interactive classes. These classes are something that are brand new since COVID. They started in April, in the middle of April, and we're up to about 53 classes per week, 7 days a week that you can access if you're a SilverSneakers member. If you're not a member, don't despair. If you don't have the benefit, I'm going to show you ways that you can engage with us and also take part in some of those workouts as well. And finally, as I mentioned before, we have our SilverSneakers Go app, which is an app that allows you to access even more workouts on your phone or device. We have about 90 different interactive workouts, and I say interactive because it's really unique. You can do one of the workouts on the app, and if it's something that's too difficult for you, or if it's not challenging enough, you can adjust that level of difficulty right on your phone or device. And now we're able to also stream our live classes through your phone and device as well through our app. So there's a couple different ways to access those live classes that we have. I just wanted to briefly mention this too. I know sometimes it's very scary to try something new, and I know since March, a lot of us have tried new things and new ways to connect with each other digitally, and maybe that's family members, maybe that's a doctor's office visit, maybe it's something like getting your groceries delivered. So we've all had to learn some new things that we hadn't known before. So I wanted you to see some feedback about what our members have actually been saying. All of our classes, I should mention, through the portal are done on Zoom. The Zoom platform, if you haven't utilized it before, is a very user-friendly platform. And as you can see, members have commented to us that it's easy to use. We've also received feedback that these classes make them feel connected, that they're able to have a routine and still feel like they're doing something to improve their overall health and well-being. At the same time, they're staying active when they might not be going out as much as they had before. So again, we're really excited to be able to do this. We think it's quite important. And as it was mentioned at the beginning, we still think that a lot of these things will still continue after COVID and after we get to a new place and a more comfortable place, because we know that we're getting a lot of positive feedback. So I mentioned our Go app. It's very easy to use. It's available free on the SilverSneakers, SilverSneakers on the Apple Store as well as the Google Play Store. All you do is search SilverSneakers and you'll find the SilverSneakers Go app. And one great thing about that is if you have the benefit, it will allow you to always access your SilverSneakers ID number, which you need to go to a gym if you're going to somewhere local or a community center to access those classes. But you can track your workouts, you can find a gym close to you. And as I mentioned before, right now it's especially helpful because you can access those workouts and live workouts through that app as well. I just want to mention briefly about enrolling. If you have the SilverSneakers benefit under your Medicare Advantage program with Humana or with another plan, it's super easy to enroll with us. You don't need a card. There's no card ever needed with us. All you need to know is your 16-digit SilverSneakers ID number, which you can get in a couple different ways. As I mentioned, you can download the Go app for that. You can also go onto our silversneakers.com website. And all over that website, you'll see places to check your eligibility. All you need to do when you do that is enter your name, your zip code, your birth date, and an email address so that we can stay connected with you and make sure that we can communicate with you about the new things that we have going on in the SilverSneakers world. Finally, you can call into our SilverSneakers Experience Center. That's our customer service team, and our representatives are super happy to talk to you about all of the great things that SilverSneakers offers, and they can answer any questions that you might have about the benefit. And that's really all you need. This is something, tuition rewards is something that's newer for us. About a year and a half ago, we partnered with this organization to leave you, to provide you with a legacy for loved ones. Just by working out. So what you can do is you can sign up for this program at the information on the screen, which we can share with you if you still need to know that after our conversation today. And what you can do is get credit for the number of times that you work out per month with SilverSneakers through your plan. So as you can see, we have more than 400 private colleges and universities across the country that participate. And what happens is you get a discount, or excuse me, a point total for registering for the program. You get 1,000 points, and then you get 250 points for each month that you work out 7 times or more. And those equate to $1 per point discount at one of those 400 colleges or universities. You can designate multiple beneficiaries, and it's just a great way to get credit for what you're doing and be able to pass that along to a loved one. I always like to mention that we do survey our members. We survey them quite a lot. Usually it's one time a year with a large number of questions about how they like working out with us at the gym and with our instructors. But this year has taken a little bit of a different turn. We've actually reached out about 11 times to our members periodically, not always the same members, but to find out how they're making do with COVID. I'll briefly talk about that as we walk through the quick site demo. But I wanted to mention that consistently what we've heard is that the SilverSneakers program does increase somebody's quality of life. They feel better all around when they participate. They make new friends, and even in this time of digital, what we found is some of our live classes, our instructors know who the regulars are. People are excited to chime in on the chat feature and say where they're from. So there is still a way to connect, and I think that's super important to us and always has been a part of the SilverSneakers program. Members actually do more than they thought they could. So I mentioned that we have exercises and classes around stability, fall prevention, yoga, all of the things that really enable you to move better and to have a better quality of life and feel healthier. So with that, I am going to remind everybody that we are available on YouTube. We also are available on Twitter and Instagram. Instagram has a lot of great stories from our instructor team, and Facebook as well, which I'll remind you of in a second. We do have live classes that happen weekly on Facebook, which we're thrilled about. We have a large following on Facebook, and you don't have to be a member to take those classes as well. So I am going to, I'm going to share my screen in a different way here to show you the brief demonstration if I can.
So I'm
let's see here.
what I'm going to do is I'm going to
Yes.
actually stop this one here. So then
Thank you.
stop sharing, and then and you can actually, hold on 1 second. So I think,
Sure.
now I did. Okay, now you should be able to share your screen from your side.
Yep, absolutely.
Just before
So
you
again,
you sign out, you need to make sure that I'm able to share, so you don't.
No worries.
Yeah.
Okay, could everybody see my screen, which should
Yes.
show you SilverSneakers? Perfect.
Mm-hmm.
Okay, so this is our home screen on our silversneakers.com website. As I mentioned before, check eligibility is very visible from the top right-hand side. So if you haven't been there before, that's where you want to go. And if you happen to be kind of scrolling down through all of the great things that we preview on our homepage, there's always check eligibility links during that time as well. So once you actually click check eligibility, as I mentioned, that's where you put the information that I shared with you before. And then after that, you're set up and have a portal account with us, and you have access to a lot of really cool features. I'm just going to briefly share with you some of our new digital experiences that you can do with us. One of them is our live classes that I mentioned. And this is the one where we actually have live instructors and classes that happen 7 days a week. We have a full schedule, and this that I'm showing to you today is actually live, so you can see what's happening. Today, we've had other classes already today earlier. We have another class left today. We have classes on Saturday. You can see quite a few of them. Whenever you look through our schedule of events, it'll give you a description of the class as well as the length of the class, and if there's anything that's recommended. Perhaps it's a chair, perhaps it's a yoga band, or if you have hand weights, something like that. It will also tell you the level of difficulty for that particular class. If I wanted to do SilverSneakers, for example, with Julie in a beginner class, I would click RSVP. That class is Saturday, tomorrow, from 11:30 to 12:15. And here's our description. We would click yes, we want to attend. And we would get an email confirmation on the email that you use to sign up for our portal. You'll also get a reminder an hour before the class and 24 hours before the class if you've done that earlier in the week. So it's a really easy thing to use. The link that you get in your email to the Zoom class is right there for you. And if you're not familiar with Zoom, there is a place that you can see right here. I'm highlighting with my cursor where you can learn to use Zoom, and we'll walk you through a demonstration of how easy it is to get connected and feel confident about taking part in that class. The other thing that I really wanted to mention right now is our on-demand video library that I mentioned, and that's where you can log in at any time that you want to, and you can take part in workouts with us from home. So as I mentioned, there's a lot of things that you can do. We have programs which are multi-week classes around things like stress management. There's also a really great multi-week program around fall prevention. So if that's something that's important to you, if you want to strengthen those muscles to, reduce the chance of perhaps a fall, we have a great program that incorporates our workouts that we have, plus some drills, as well as an assessment at the beginning and the end that can tell you if you've advanced in your skills, and how much you've done. So it's a pretty great program. Another thing I'll mention is that we have a number of workouts here. You can see we have different collections. We have dance, we have nutritional videos. We also have things that we feature. So everything can be clicked on, and you'll see a number of videos behind all of these. You can favorite them so that you can come back to ones that you specifically like. And it's, as I mentioned, really easy. And I'm just going to click on this really quickly so you can see. It asks you to accept terms and conditions before they get started. So again, it's going to recommend that you've already talked to your physician as well. And so that, I know I don't want to take up too much time. I think I'm almost right on time. Am I right? Hopefully.
Yeah, very good. Very good. This was very useful. We actually shared the link for your portal from our social media site. So our patients should be able to find it very easily. And we are now, I think, following each organization is following each other. So there will be some more access and visibility for our patients. So now one of the go ahead.
I'm sorry. I just wanted to one more thing I wanted to do before I finish is just remind everybody that we still do have a Facebook page too. Mm-hmm. So I apologize. I meant to say that before, but this way you can access videos if you don't have access to SilverSneakers, the benefit, but you still want to be active, or if you just like to go or prefer to go into SilverSneakers or within YouTube, we have a channel with a ton of videos out there as well. So again, some of the same content, but you don't have to log in through the portal if that's not a way that's comfortable for you, or if you don't have the benefit. So I apologize. I realized I hadn't touched on that, so I wanted to do so.
So one of the things that I just want to highlight, I'm sure everyone is listening, but sometimes I feel like it's important for me to just repeat some. This is not just for one insurance company. Your platform is many insurance companies. They may be available for those patients. And also, there are some programs that it's free for everyone, or like not free, maybe registration is not required, versus some they have to be part of the insurance plan, I guess, right? So that's kind of like probably that's the most frequently asked questions. One of those questions. So is that correct?
It is. So I would like to say that if you have a Medicare Advantage program, please double check your benefits, because a lot of people have the SilverSneakers benefit included with your Medicare Advantage program, and they're not aware of it. And as you mentioned, it is typically free for somebody, so that you can go to visit a gym, or you can have access to all of these great things underneath your health plan. And again, as I mentioned, we have avenues where you can connect with us without having the benefit as well. But if you have the benefit, you have access to a much wider range of digital and in-person opportunities.
All right. Tanner, do you have any questions?
I don't think so. I think this was a really good presentation and good information, like Kemal had mentioned, for our patient population. I've been actively working with my team to look into the public information SilverSneakers has, especially like the blog posts. I found that those are really good. All those articles to be able to share on our pages as well. So we'll continue, like Kemal mentioned, to have SilverSneakers going forward with part of our digital health resources that we'd like to provide to our patients. So I really appreciate you joining us.
Wonderful.
Great. Thank you so much for
Thank you for the invitation.
Thank
you.
Bye-bye.
Bye-bye. Thank you.
All right. So we are going to keep going with our rest of our agenda. We would like to discuss the vaccine rollout and the issues and how we can actually fix certain things and what we can learn from this experience. So we want to kind of keep this part separate from the guests, so then they are not, in case they have any, if they're not agreeing, maybe like we didn't want to put them in a difficult situation. So that's why we kind of separated the events. So we are gonna give you some updates, and we are open to hear different opinions, different suggestions, but our goal is to educate our patients, make this available for public. So after our last session, I got some direct messages from some of our followers regarding some of the comments that we made with the state of Delaware. And we want to make sure that we make our point very clearly. And that's what we are going to discuss for the remaining of the time. Now, from the rollout standpoint, before we get to that, as we promised, we are giving side-by-side comparison of the vaccines available right now. So the two that we have, there are no big differences except the interval between the two doses. One of them is 21 days for Pfizer, the other one is 28 days for Moderna. Now, these upcoming ones, AstraZeneca won't be available in US unless something changes until April, and J&J has an update, and Tanner, you prepared that for us. If you can just explain that.
Sure. I was reading this morning, and I believe it was yesterday, actually, that Johnson & Johnson early stage clinical results from their phase 3 of their trial are starting to come out. So we're starting to kind of see with that initial population of patients or of people, I guess, that they are running their clinical trials on, we're starting to get some side effect details coming out. So far, from what I was reading, Kemal, there's really not a whole lot different, which is good news. So it's kind of uniform across the board, depending on whichever vaccine you may end up getting. The one thing to mention is with the Pfizer and the Moderna vaccines, the fever was pretty rare as a side effect, so it really wasn't anything worth mentioning. But from what I'm seeing with the J&J one, it's a little more common. So that's really our big difference so far. Other than it's worth noting, the other two are going to have an interval in between, as you mentioned, because it's 2 shots. You're going to get a first and a second dose. With the J&J, it's a single shot vaccine. So those are really the 2 big differences so far. So we're still waiting for a little more data to come out, especially with the target population, when it'll be available, things like that.
So Tanner, I guess one of the, again, difficulties is the entire rollout process and the challenges that we have. So what do we have here?
So we're making a little bit of progress, I would say, nationwide. I think last time we spoke, we were at a little less than half of what we're at now for amount of people who have actually received the first dose of the vaccine in the United States. So we're at 11.1 million as it stands from last night. And I believe this data is coming in from us from last night. So things may have changed a little bit, hopefully throughout today. But we're getting roughly 11.1 million from our 30.6 million doses that have been distributed across the states or allocated to our states from the national government. So looking for Delaware specifically, this is something we started to talk about last week. Well, if you want to go to the next part, I have an update for our distribution in the state of Delaware. So we've had about 31,000 first doses successfully administered as of yesterday as well, with an additional 81,000 first doses scheduled for delivery here in the next week, I believe that is. So breaking this down a little bit further, we have in the state been allocated 31,000 first doses, or rather administered so far. But I know it's something we've talked about, and data that or information that we're getting from the state is their rollout plan, right? So with the first phase being our 1A and 1B, which makes up our prioritized population. So what we have seen so far with the administration of the vaccine, that only covers about 5.4% of that first 1A, 1, or even really the 1A population of their rollout, which is supposedly our frontline medical healthcare workers. And that comes out to be about 3.2% of the state's population. So we have about enough doses to vaccinate 14% of the prioritized population so far, Kemal, but we're only at about 5.4%, which is concerning. Oh, I think you muted yourself.
Yeah, I did. Sorry. That's one of the reasons that we have the frustration again, right? So the reason we sound a little bit agitated is because we do reach out to the state officials to make this more efficient. Now, we all know that state or the federal governments, they are not business-like corporations, so they are going to be slow and inefficient. We accepted that. But what we don't accept is when it's about the population health crisis, we need to let others who know this better to guide the state officials. And that's what we are doing here. So I do want our people to understand, just so that we have a good foundation of the problem. So like we have the phase 1A and then we are going to the 1B, it didn't start yet. Now the riskiest population 65 and over, they didn't start yet. But the process that we can get to that is extremely difficult. Now, most of you are familiar with this, and we are going to give you the updated number once the December is final, I believe. Almost 117,000 patients at the primary care level. We provide services, and when we are not being represented in the state Department of Health decisions, that is concerning. So, because this is affecting everyone. So this is not just for one part of the population is going to do well and the rest is not. So when we, from the private business, private practice, when we put this much effort into what we are doing, we want this to be heard. Two, we want changes. And one of the things that we are not going to give up is following these and being persistent with what we are trying to achieve. And until we get there, we won't let it go. Now, I got my vaccine yesterday. One of the really disappointing, perhaps. So I promise that I will not use certain terms. So, and I'm going to keep my promise. But overall, I'm disappointed with the way that vaccine is received by even our patients. I mean, not the patient, but just overall the public. So. Tanner, you remember our survey, almost 40% said that they were not going to get it, and they were not kidding.
Right.
So they are not getting it, and it's more than 40%. So we try to have our medical staff for United Medical ACO, and the total number should be more than 500, and I think it's going to be around 200 total. Mm-hmm. And the difficulty, what we actually what we deal with, even getting those people and the process with the state, it is extremely cumbersome. So we want to share this with with public so that they understand, because many people who are not in healthcare, they may not understand all this, and they may have a different view of what's happening, but that's not the case. So I got with our other medical staff. I got my vaccine yesterday. I did not have any side effects. Now, but this is almost 4 weeks late for us. If I was a hospital employee, I would have gotten my first dose 4 weeks ago. Now, we want the discrimination issue to be addressed by the state. Our accountable care organization is, the infrastructure is there for us. So we are just like any other healthcare organization, maybe, if not, we are maybe more efficient. So I do want to thank, with this, with the opportunity we have, first Hazel Demat of United Medical ACO. She has done a fantastic job. Anthony, one of our directors for contracting, he dealt with the state and he has gone through a lot of trouble for us. Our medical staff, our nurses, our medical assistants, our providers who are willing to do this for our medical staff. This is extremely important because we need to be able to support the 116,000 patients that we are providing services on a regular basis. So that's our entire reason. So we want to make this society healthier. That's our main goal. Now, what we want to discuss today a little bit more into this Delaware physician layout, and some of the terms that we use here, you may agree or disagree, or it could be better, yes, but we want you to kind of understand where the accountable care organizations are in terms of the Delaware structure. And there are 4 ACOs. Tanner, some of these, they started before you started with ACO, so I'm going to, as you know, there are two ACOs that are which are private. United Medical ACO is one of the early on. Structure-wise, we were the first one, and then we got our Medicare ACO in 2016, and we are the only ACO who had Medicaid contracts starting from 2017 and on. Now, there is another private ACO, which is Validate, and then there are 2 giant ACOs. One of them is bigger than the other one. They are hospital-based. Now, forget the differences, but this represents 80% of the health care providers in the state of Delaware. Now, we have close to 200 providers, and we are sharing our numbers pretty clearly. So, we are open about it. We want our voice to be represented in the decision-making process. And now, last Wednesday, and I do like the people who are part of the, Delaware Health Services Office, Dr. Hong, who was our guest, and there are other people who are really trying, but then we want all the barriers out of the picture so that we can actually help them. We are not trying to interfere with what they are doing. We are trying to help. Not only we are trying to help them, but we are trying to help our community. Now, what it is that we see here is I have this disastrous call last Wednesday by the state, and it was a voice call, just like you call, like if you didn't have a TV, or like I use this 1967 analogy, like many of my people would know what I mean by this. If something is outdated, I always say about let's leave 1967 in 1967. So we have all the technology available, and if state doesn't have the money, then we can give them our Zoom access. It's fine. But Zoom meeting with the presentation, that would actually make it a lot different. So this is the twice a week my meeting with my people, and this is what state is doing. State is about 40, 50 years behind the reality. And that makes me really worried about their perception of the medical practices, Tanner. So now when you look at our different events that you are a big part of these, how we are actually sharing the information, it's a different, time.
Much different avenue.
I'm not a robot. Like I'm not AI. I'm a person, just like any other. So why can't state do this? So and that's kind of like where we are with this now. One of the big issues that we have, understanding where the practices are in terms of the private practices. I'm the advocate of private practice, so that's because of me. I'm not going to be humble about this. Because of me, there are more private practices. When there are more private practices, yes, doctors are able to benefit from it, but also public benefits from this. And how they benefited, because we provide the same service in a much less expensive, a lot less expensive way, so then they are able to pay less for maybe even better quality. Now, what we have seen, when we bring these issues up, and if people are not familiar with what we are going through, they think that we are just being moody, and that's not the case. So what I have seen just a couple of days ago on CNN, they were discussing the private practices and how the doctors and the medical staff and the patients not having access for vaccine.
Sure.
When the vaccine utilization is only at 30%, maybe even less in total, why are we not making this available for more people? So, and this is kind of reassuring the problem that we are having. So unless private practices are represented, and the infrastructure for that is what we have in place, just kind of to share what that news from CNN was. Just this is the Florida practice physicians. They were having these issues. They don't have access. It's not Delaware specific, right, Tanner?
Right. I think, the DPH call that we did, that we were on the other night, really highlighted this, that it is a statewide problem, but this only reinforced it. And I know you mentioned number-wise, I think the average, if I'm not mistaken, is around 30%. So Delaware is on about the national average for percent of allocated vaccines that have been actually administered. And this is not just it's not a UM problem. It's not a state of Delaware problem. It's a much larger problem that we're seeing with private practices. So the CNN article came out just last week discussing some of the issues that they're having. I believe this was a private practice in Arizona, just talking about how they're not sure when they're going to get the vaccine. They don't know when they're going to be able to provide it directly to their patients. And the great point that they make is they're seeing, they have the capacity, they have the ability to then be able to administer, I think he says hundreds, if not thousands of vaccines, just amongst the private practices in the state of Arizona. But I'm sure it's similarly here in Delaware, just about every day. So that's a huge piece of the puzzle here to really be able to get the vaccine available and into the arms of the public population that's missing here. This is a great representation of that as well. We put together this graphic just to really highlight the essential piece that is the private practice and your physician, your family physicians, your specialists. These are all part of the healthcare network that is keeping you away from the hospital, keeping you out of these other institutions. And it's really where the beginning of a patient's preventative and primary care is starting. So
what was really interesting from Wednesday night, and because it was a public call, I don't have a problem making some references. Dr. Rubaki of Dover Family Practice, quote, he said, he is able to do 5,000 flu vaccines a year. Why can't he just do the COVID-19 vaccine? And then they still don't have it.
That was he voiced that frustration, and that actually made me think of, and we shared it a little bit maybe a few weeks ago when we did our flu vaccine drive. And we saw just yesterday when we started here with the United Medical Clinic administering the vaccine to our medical staff, just how efficient it truly can be. They did a great job over there. I know you mentioned Hazel already, but it was so efficient. It was very well put together. And it's not that we don't have the means to be able to do this. And I think he highlighted that as well on the call. And it sounded like
when it comes to these types of operations, we are more efficient because we know how to actually make this happen. Hospital system is not to provide vaccine for public. We try to keep the patients away from the hospital, and you're trying to force the patients to the hospital. So all my doctors who normally don't go to the hospital, you ask them to go and get your vaccine at the hospital. And all the hospitals are doing is just getting a good picture with the president-elect and just promote their name. But this is the vaccine that's not being paid by anyone. It's given by the federal government. So no one should be benefiting from this. No one should commercialize this. And most importantly, we need to be represented. ACOs, there are 4 ACOs. These ACOs proportionately should be in each healthcare committee of the state of Delaware. Now, I will be 47 in a couple of weeks, but I'm still 46. I'm young enough. I'm not going to let this go. I am going to follow this through until I achieve what we should have for our private practices. We'll use every legal media channels to voice out our opinions and make this possible, because public benefits from what we are doing. So it's not, again, last time I said the same thing. We are not selling some products. We are providing service for people. And when we don't do this well, there are consequences. And we are well equipped to deal with those. We have the most experienced providers. Like just, I'll just tell you something. If you have an emergency appendix or gallbladder, chances of you getting your surgery done by a resident 4th year or 5th year is 70%. So I just need people to understand this. So hospital doesn't mean that best quality. Hospital means that in some cases it may be, in some cases they are not the best places for patients to be. I don't want to be operated by a resident. I want to be operated by a real doctor who has a board certification. Dr. Erkan, Dr. Wynn, Dr. Peters, Dr. Ibrahim, Dr. Singh, these are board certified bariatric surgeons, right? So I don't want anything less. And we have that. Our cardiologists, they are all board certified. All of our providers are board certified. So I'm not going to be seen by a primary care resident at Christiana Hospital. So,
and if I may, real quick, Kemal, just on that same note, it's something that I think was highlighted in that CNN article that really made me think. I think a lot of patients too, when you first think of the hospital, it's where you're going for emergency for the most part. It's where you're not going for your preventative care. And it's kind of may be a little intimidating for some people to have to go to these large institutions, literally large buildings, to just get this COVID vaccine. And I think that they'd be much more comfortable going to their primary care doctors who they're already trusting with their health on the day-to-day.
Absolutely. Ken, I'll give you one example. For our surgery center, since we started doing the bariatric cases there, it's a smaller operation, right? So it's just the OR side of it. It's actually, it can be like a small hospital. Our nurses are the same nurses every day. So on the bariatric program, the nurse who is part of that program is probably the best, who knows her staff better than anyone else. And we don't change that. So if you're in the hospital, you may be assigned different people based on, because it's a larger scale. And I'm not saying that this is better than the other, but I'm saying that this actually is the quality-wise and the efficiency-wise is much better for the patients. And we are able to do that. So then why would you not hear? Again, like just imagine my organization, Governor Carney, again, my organization provides 116,000 patients their healthcare services in the pandemic. And you and I, we still haven't talked. And you didn't actually recognize the ACO as a healthcare organization. So I still have to roll the practices, roll them out one by one, and then we come up with the idea of the hub, and then just now we have some not very optimal way of dealing with this. ACOs are part of the system, and then that's the best infrastructure that we have. I need you to understand this. We are not actually competing with you. We are not trying to harm you. We are helping you. Because if the public is safer and if they're healthier, you are going to get the credit. We are not. So that's what we want. So our next week topic is going to be going into the state committees and the distribution of this and who's being represented in these committees, which hospitals systems is heavily there, and where we are in terms of the ACOs. And I want our public to know what we are dealing. So hopefully we can go into that a little bit more in detail, Tanner, next week. And we do want to remind our patients, please use your patient portal, because that's the most efficient way to reach out to us. You don't want to be aggravated on the phone waiting for 20 minutes to cancel your appointments or getting your medication refill. Patient portal is the best way for you to reach out to us. We are going to discuss on Wednesday, January 20th, on the bariatric surgery journey. What can I expect after bariatric surgery? This is the session that we have done, but we are going to do it in the 2021 style. So Dr. Erkan will be my guest. And that's pretty much what we have so far from our side. Tanner, anything you want to add?
Just in addition to that upcoming bariatric program or surgery journey that we have next week, of course, we have this event at its regular time next week. And also we just had the diabetes wellness group, which was this past week, which was a great presentation from Amy, yourself, and Donna. So that's up as well. There's always information, plenty of places and resources to find that we're putting out. So we hope to see you guys all next week.
Well, thank you again, and thank you for being with us, and we'll see you next week.